This is about internal anatomy and needles. Biopsy. By biopsy, a small part of an organ or structure of the body, some small part, is taken with a hollow needle out, and when under a microscope it is looked in detail onto it if there are any abnormalities, any diseased cells or something. And that can assist and help to find what disease someone has, or to confirm it that it is the one, or if someone has cancer, what type of cancer. So that is biopsy. According to Keith Hodgkin's Family Medical Advisor book on the page 19. But this is now medical advice. If you click this video away, then please tell me what the reason for it was, so that I can improve. Otherwise, hi and welcome. I'm trying to learn medicine today, biopsy and blastomycosis. And after we've done it, we're gonna do squat training. And if you participate in the squat training, then it's at your own risk. These are just dictionary entries. And we're talking about internal anatomies, diseases. And this is no medical advice. I'm just reading and trying to understand. Biopsy. A process in which a small piece of tissue is taken from an organ or structure of the body and examined microscopically in order to detect the presence of abnormal or diseased cells. We're saying here microscopically. Is it possible that other things are done with it? Because basically the question is, if I say also microscopically, would it exclude that other things are done? No, it wouldn't exclude it. I'm going to say microscopically. I'm preparing a presentation about whatever you're reading here. So biopsy. Okay, a small part of an organ or structure, a small part of a human body is taken, and when under a microscope looked in detail under it, if there are any abnormalities, abnormal or diseased cells. The sample of tissue is most commonly taken by means of a hollow needle that is passed into the organ under a local anesthetic. Hollow must mean that there is a hole in it. So it's a needle with a hole in it. So we're talking about a bit about needles now. A needle with a hole that comes in, and then a piece is taken out. Under local anesthesia, so that the person doesn't feel what is happening at the place, if it works properly. A biopsy may confirm or assist in the diagnosis of many diseases, but is especially important in the early detection of cancer. It can help to confirm. It can help in finding what disease it is. So finding the diagnosis of a disease, or finding to help what disease it is, or to confirm it. Of cancer, or what disease or cancer, whatever it is. Doesn't really make sense to say it. I'm rehearsing right now. Whatever. Okay, biopsy. A small part of the body is taken. Is most of the time done with a needle. A small part of the body is taken away of an organ or structure, and then under a microscope, under the little pieces, and look in detail under if there are any abnormalities, and that can help. Okay, I'm going to start the second camera and I'll try to say it. This is about internal anatomy and needles. Biopsy. By biopsy, a small part of an organ or structure of the body, some small part, is taken with a hollow needle out, and when under a microscope it is looked in detail onto it if there are any abnormalities, any diseased cells or something. And that can assist and help to find what disease someone has, or to confirm it that it is the one, or if someone has cancer, what type of cancer. So it is biopsy. According to Keith Hodgkin's Family Medical Advisor book on the page 19. But this is now medical advice. I'm stop the camera. And we have a thing. Blastomycosis. Blastomycosis, rare, infectious disease which has two distinct forms, each caused by a different fungus. Okay, it doesn't happen so often, and it is a disease coming in through an infection. There are two forms of it, and both are based on a fungus. North American blastomycosis, which occurs in the United States of America and Africa, mainly involves the lungs, but sometimes spreads to other organs, the bones and the skin. South American blastomycosis is a disease of Central and South America. It can affect the skin, lymph nodes, internal organs, or all three. There's nothing more written. It seems a little short. No symptoms, nothing. And the question is, are we making a presentation about it? It's better than nothing. Let's make one. We can just retitle it or give it a good title. But it doesn't make sense. It doesn't make sense. We're not going to do a presentation about it. Let's just read it again, and then we're going to move on. Blastomycosis, a rare infectious disease which has two distinct forms, each caused by a different fungus. North American blastomycosis, which occurs in the United States of America and Africa, mainly involves the lungs, but sometimes spreads to other organs, the bones and the skin. South American blastomycosis is a disease of Central and South America. It can affect the skin, lymph nodes, internal organs, or all three. That was the medical part. If you use the medicine, you can go directly to the next part of the medicine, where we go to the next disease. If you stay here and participate in the squat training, that's really focused. We are bringing one leg up and circle the foot. The walrus's morning stretch. Other direction. Up, and circle the foot. Up direction. And take the leg at the ankle. Make it straight back and point with the knee down to the ground. Other leg. Straight back, knee down. And to the side. One leg to the side, toes are pointing in front. We're stretching the inner side of the leg. And to the other side, toes in front, stretch the inner side of the leg. And the mentis go from side to side. And back into the leg. And now the squats. Legs wide apart, and we're doing 12. So the first one down and up. That was the first one. And the second one. And that was already a 3. And that number 4. 2 more, and we're having the half. The last one to the half. And now let's go on strongly into the second half. 8 and 9. And 2 more, and we're having 10. So that's the last one for 10. And now the last 2, 11 and 12. And now the 6-pack squat squeeze exercise. Down into quarter squat and press against the top part of the leg just on one side. And now on the other side. Down into half squat and press against the middle of the leg. And on the other side. Down into 3/4 squat and press close to the knee. And on the other side. And up again. And now the fastest giraffe of a water pond exercise. Down into 3/4 squat, press against the knee, and go towards it. Again, press, go towards it. Press, go towards it. Again, press, go towards it. Press, go towards it. Press, go towards it. Last 2. Press, go towards it. And press, go towards it. And up again. Last exercise, the propeller. Down into full squat, arms to the side, over to one side. Press against the leg, look up to the head, little bend in the elbow. Middle and over. Press against the leg, look up to the hand, little bend in the elbow. Middle and up. And we're ending. Heel onto the ground. The high heel top stretch, pull the toes in. Put to the left, pull in. Put to the right and pull in. Middle, move from left to right. Other leg. Heel onto the ground, pull in. Right pull in. Left pull in. Middle, and move. Again, the walrus's morning stretch, other direction. Other leg. Change. And the crane again. Change. Legs wide apart. Breathing it out. Out. Breathe in close place. And breathe in out. That was the squat training. Thank you very much, and until next time.